Hi, my name's Mark Pulley. For those who are watching and followed the series, I guess the best way to call it, this would be my fifth instalment, Diary of a Brain Tumour Patient Part 5. I understand it's been coming close to 2 months since my last video upload, so there's a bit to catch up on. My previous upload was just before I was due to go in for my next batch of chemotherapy. That would have been my third cycle back then in July. That went okay, not as great as my first two cycles. The third cycle really did decide to take it out of me. It was to be expected. My energy completely disappeared. I was bedbound a lot of it. I was exhausted. I felt quite sick. I had to take quite a few anti-sickness tablets, and yeah, that really knocked it out of me. So the kind of the 10 days was really difficult. That was my third cycle of it. Today is the 8th of September 2011. Time is 8:49 p.m. Today was the day that I was going to have my fourth cycle of chemotherapy. However, that's been postponed for another 2 weeks, as my blood results didn't come back with very good results, to be honest. I was admitted to hospital at the beginning of last week with severe abdominal cramps. I was sleeping 20 hours a day. Something was wrong with me. I ended up being sick. Doctors ended up called out and I was admitted to hospital for a day and a half. I was given IV antibiotics as I had a fever, and they knew I had an infection of some sort, so they gave me some antibiotics for that, and they put a few bags of fluid through me, so I had to pretty much stay in for a couple of days, get my system back to normal, which it eventually did, which is good news. However, I got home and my nephews and brother and sister-in-law came over from Holland to come visit. But as much as I love my nephews and niece, my family, and as lovely as it was to see them, my nephews decided to bring over another load of germs as well. So I ended up picking up what they had and suffering that as well for another few days. So I had a week of pretty much being constantly ill, which wasn't exactly what I'd consider fun, but what can you do? So today was the day I was supposed to have chemotherapy, but the blood results really did not show very good results at all. My LFTs, which are liver function tests, were very high, which is not a good sign. It means that they theorised that the antibiotics might have had some interaction with my anti-seizure drugs, and it's just kind of raised the LFTs a bit too much, so they're going to wait a couple of weeks to see if that goes down. And also my platelets, which the normal platelets are designed to things in your blood that stop you bleeding. So when you cut yourself, or get cut or graze or something like that, the platelets help to form the scab, as it were, to stop your bleeding. These normally the value of these is in a normal person between 140 to 450. Mine were at 36, which was really low. So they were not wanting to put me through any. They weren't wanting to put me through any further chemotherapy until those have raised up a bit. So I have to I said wait till the 22nd of September, and that will that's when I'll have my next, hopefully my next batch of chemotherapy, and that'll be cycle 4 out of 6. The only good thing about seeing my oncologist today, I guess, was I got to, it's the halfway meeting point that we were talking about after the 3rd cycle. They said they'd sit me down, have a chat with me to find out if the treatment's working or not, because 3-4 months would be the least amount of time that could go by where they would see if there's a difference or not. And they brought up my brain scans up on the the hospital computer, and there were 3 results they were expecting. Either it's not changed and it's remained stable, which would have been a good thing. It would have shrunk, which would have been a very good thing. Or it would have gotten bigger, which would have been a bad thing. And I can happily say that it's, well, not happily say it was not ideal, but it's stayed the same. It's been kept at bay, which is really good news. It is good news, but it wasn't the news I was hoping for. I was hoping it would have gone a bit smaller, but you can't always get what you want. And we'll just have to wait and see what the next 18 weeks will bring after my ending of my chemotherapy regime. But that's something I'll just have to wait and see. That's all I think I can update you with at the moment. I don't think there's anything new, anything more I really can really talk about. No, that's it. Thank you very much for listening. I'm doing this as much for myself as for other people that are possibly going through similar things to what I'm going through, whether it's a brain tumour or similar cancers or all the rest of it. I've kind of learnt to accept what I'm going through. It doesn't make it any better, but it makes it slightly easier to bear with this burden. But yeah, thank you very much for listening, and take care, and I'll try and update you later this month or when I'm going through my next batch of treatment. Take care.